In my commentary on the article, Patient-Centered Care, Factors Associated with Reporting a Positive Experience at U.S. Fertility Clinics, I commended the authors on the collection of a very large data set that was collected through the Fertility IQ Questionnaire. The authors present data from 7,456 female fertility patients and identify modifiable factors associated with a positive patient experience at U.S. fertility clinics. I want to reiterate my praise on presenting this important research, in particular because there has been so little research on this topic here in the U.S. I don't think it's surprising that the strongest predictor of a positive patient experience includes physician characteristics and traits. But it's such an important finding and has such significant clinical implications that I felt it even more important to present meaningful data in regard to the findings on personality. And this is where I stated my strongest critique. Variables, such as personality characteristics and traits, would be considered psychological variables and need to be measured in a way that, unfortunately, the Fertility IQ Questionnaire just isn't able to do. Furthermore, the Fertility IQ data is the only data source presented, which further weakens the findings. The researchers included a particular study in their lit review that's a better example on how these types of variables might be explored. The Mourad Study from 2010, which, like the present authors, explored determinants of patient experiences, looked at almost 1,500 infertility patients and utilized methodology that I think captures the psychological piece more fully. They used an already validated questionnaire and then modified it to meet their research needs. They also included a measurement of mental health status with the use of the State Trait Anxiety Index and the Beck Depression Inventory, both of which are well-validated measures and both with a lot of research behind them. Their finding was that mental health was a determinant of positive patient experiences, in that lower levels of anxiety and depression were related to a more positive experience. When we see this type of process used to measure patient experience, it highlights how the Fertility IQ Questionnaire is the only data source for what the authors call physician traits is a significant limitation to the present study. I couldn't find anything on the Fertility IQ Questionnaire that described a formal validation process, although it is purportedly created with subject matter experts and a group of fertility specialists. And while I think it's probably good for the gathering of more concrete data, the questions that the researchers present as personality variables were assessed with a small set of questions that don't really capture this type of psychological construct in a meaningful way. And although there were also open-ended questions included, the researchers did not do a thematic analysis on that data, which I think would have added greatly to the data that they presented. The paper tells us that patients prefer doctors that are good communicators. But what does that mean? What factors go into making someone a good communicator? Furthermore, if we know that mental health status impacts patient experience, as the Mourad study tells us, how might that impact a patient's perception of their physician? And in order to move the literature forward, shouldn't we consider this in the development of a study such as this? I recognize that the study represents an epidemiological study, and the data presented is a good first step in identifying modifiable physician characteristics that might impact patient experience. There are significant clinical implications, but in order to implement change and improvement in any patient experience, we really need to know what that means in the context of these findings. And I would argue that the variables of interest are psychological in nature and then must be explored using a social science perspective. And while I recognize that psychological constructs such as personality variables can be difficult to conceptualize and measure, I offer this critique in the spirit of collaboration, in that I think this study would have been a good opportunity to bring in mental health researchers who have expertise in working with just these types of variables. Including a social scientist in developing a follow-up study might have a positive impact on a study such as this.